Well, welcome back. In order to help Americans navigate through Obamacare, call centers have been set up across the country. But one of those centers in California tried to skirt around that very insurance. It hired half its staff as part-time, then told employees that they are responsible for paying for their own health care. Joining us now is former Lieutenant Governor of New York and author of the book, Beating Obamacare, Your Handbook for Surviving the New Health Care Law. It's Betsy McCoy, and she is probably the only one who has read the health care law, and she has it here in all 3,000 pages in front of her. Nice to see you this morning, Betsy.
Thank you.
So what is going on with these call centers?
Well, first of all, the hypocrisy of it. The Obama health law says employers have a responsibility to provide health insurance for their workers unless the employer is Obamacare itself. So the call centers are saying, we can't afford this. We're going to push a lot of our workers down to part-time status. But the more important issue here is that the employer mandate is having this impact all across the country. You'll see that in the June federal jobs report, for example, almost all the jobs created were part-time jobs. That's very unusual, atypical. And it means that people have to cobble together a living with 2 or 3 part-time jobs and no benefits instead of a full-time job that offers benefits.
Now, we heard about this delay, right, that the Obama administration is saying we're going to give employers the opportunity for this employer mandate delay now for another year.
Well, let's point out 2 things. First of all, so far the delay hasn't been much of a reprieve. It's more like a whiplash because employers really plan ahead. So they're going to keep pushing their workers down to part-time status. And it's not just corporations. It's municipalities, community colleges, state governments. It's happening all across the country. But secondly, this delay, which was announced very quietly and presented as kind of an administrative tweak, was actually a clever ploy to drive workers into the health insurance exchanges. Kathleen Sebelius, the Secretary of Health and Human Services, had tried to get the NBA and the NFL to convince young, healthy, working-age people to join the exchanges, which is essential to offset the cost of the very sick people in the exchanges and keep premiums from spiking.
But I thought that this was I thought that the administration didn't want to, or they have been saying we weren't going to drive so many people to
Oh, no, they very much want to have as many people enrolled as possible in the exchanges, young, healthy people, so that the premiums won't spike more than they already have.
So they're having trouble selling this car.
Well, it's because it's like trying to sell flood insurance to people who live in a desert. These young, healthy people don't need this long list of benefits and this very high premium, so they're not buying. Now, here's what happened, though. By delaying the employer mandate, about 10 million workers who would have gotten coverage on the job through their employer now are between a rock and a hard place. They have to pay the penalty for not being insured or go to the exchanges. So what the delay does is it shifts the cost from employers to Joe taxpayer. Obama makes out well politically, but Joe taxpayer gets clobbered with billions of dollars in extra costs providing health insurance for people who would have gotten it on the job.
As complicated as this law is, I find it hard to believe that some college kid who's working a part-time job at one of these call centers is going to be able to answer these questions for seniors and other folks who are having to call and say, I don't understand page 450 of this bill, and I need some help with it. Troubling stuff this morning. Betsy McCoy, she's read the bill. She's probably the only one who has. Nice to see you. Thanks so much.
Nice to see you.
Coming up here.